This intimate sound often brings up a lot of questions, maybe even a little bit of embarrassment. It's puzzling, it's intriguing. So let's just ask the question plainly. What's causing it? To answer that, we're going to have to bust a common myth and explore the absolutely fascinating mechanics of the human body.
So, the first and most crucial distinction we have to make is this. You can't confuse this sound with intestinal gas. The common term for it is actually a scientific misnomer. The origin of these two things is completely and radically different.
On one hand, you have intestinal gas. Now, that's the result of a chemical process, the fermentation of food by your microbiome, which produces smelly gases. But on the other hand, the sound we're talking about is a purely physical phenomenon. It's simply air from the room that gets trapped and then expelled. It's a mechanical process, and because of that, it's completely odorless.
So, how does this air get trapped in the first place? Well, the answer is in the way the vagina's anatomy changes during arousal. You see, you shouldn't think of it as just a simple cylinder. It's a dynamic structure that takes on a very particular shape, almost like a diabolo or an hourglass.
The analogy with the quack beer glass is actually perfect for visualizing this. You know that glass with its wide round base and its narrow neck? It's a great illustration of the shape the vagina takes. The back of the cavity widens and lengthens, while the entrance stays narrower. And it's this unique geometry that is the key to the entire mechanism.
This whole process happens in a few stages. At rest, the walls of the vagina are touching. It's what we call a virtual cavity. Then, with arousal, the cavity expands and the back widens, creating that diabolo shape. During penetration, the penis acts like a piston, pushing air to the back of this chamber. That air is now trapped. Finally, the movements of intercourse or withdrawal change the pressure, forcing the air to escape, and it's this rapid expulsion that produces that characteristic sound.
Now, certain factors can amplify this phenomenon. A high level of lubrication, for example, can create a kind of airtight seal at the entrance of the vagina, making the air trap even more effective. And likewise, positions where the pelvis is tilted, like doggy style, use gravity to help funnel air toward the back of the cavity, making it easier for it to get trapped. Now, this next point is absolutely crucial, knowing how to tell the difference between a normal phenomenon and a situation that might indicate an imbalance. Because while this sound is benign in most cases, its frequency and the context in which it occurs can be really important indicators. The phenomenon is considered normal when it's occasional and often linked to a particular position. On the other hand, you should pay a bit more attention if it becomes systematic, happening every time you have intercourse, or, even more importantly, if it occurs outside of any sexual context.
Let's look at this like a dashboard. Depending on the symptoms, we can identify the probable cause and then figure out the most appropriate action. It's an approach that's both pragmatic and, honestly, very reassuring.
So, if the sounds are happening systematically during intercourse, the cause is often a slight imbalance in the tone of the pelvic floor muscles. The recommended action is pretty simple: pelvic floor strengthening exercises you can do at home. However, if these sounds appear outside of intercourse, it could suggest a more significant loss of muscle tone. In that case, it's a good idea to consult a professional, like a midwife or a physical therapist, for a proper evaluation. You have to remember this key message. For the overwhelming majority of women, this is not dirty, it is not abnormal. It's simply a mechanical event, a perfectly natural part of anatomy in action during sex. It's an integral part of the physiology of sexuality.
So in short, there's no mystery, nothing to be taboo about. What we've just broken down is nothing more than a physics lesson applied to human anatomy, a purely mechanical principle that explains